Welcome to Medical Myths, Legends, and Fairy Tales. I'm your host, Dr. Alan Christensen. Look, you know that between the latest online fads and the crazy media headlines, it's easier than ever to get confused about your health. And you and I just want to feel better and live longer. We want to know what works. And we can't wait for further studies. We need to make decisions today based on the best evidence we've got. Well, that's exactly what this show is here for. So let's get to it.
Hi there, this is Dr. Linda Kushaba from Integrative Health. Would you like some help with your thyroid? We would absolutely love to help you out. And guess what? We can even do remote care. Please call us today at 480-657-0003 to set up your first appointment. If you mention code podcast20, you will get 20% off from your first visit. That phone number again is 480-657-0003, and the code is podcast20. Can't wait to meet you.
Hey, Dr. C here with you. Welcome back to another episode of Medical Myths, Legends, and Fairy Tales. So this is a lot of fun. This is going to be a group discussion with the docs. Bit of a group discussion, some insights. So we had a case review to discuss, and then we talk a little bit more about how iodine, we know it can be a concern. Excess can be a difficult thing for those with thyroid disease. And it's not just from what you put in your mouth. There can be other sources of iodine. So let's lead with the case discussion real quick. And this is Dr. Raquel Espinol.
Thanks. Hi, everybody. So I had a patient the other day come in and, she's been pretty stable on her thyroid medication for quite some time. But we saw that with this latest blood draw, her TSH was jumped up to 12 and, trying to walk through her day, what is she eating? What are her sources of iodine? Those sorts of things. Her diet seemed to be pretty good, but she had a question, or we were talking, she bathes in Dead Sea salts. And, I was trying to find online, pours a bunch of it in the tub, and she was doing it, for some months. And so just curious, I went online, tried to find out the sources or the amounts of iodine in Dead Sea salt, and I really couldn't find anything. So Dr. C, do you have any input for us on that?
Well, in terms of the amount of iodine in Dead Sea salt, I didn't find a lot of data, but the data that I did find suggested that there could be fair amounts. It is obviously very densely saline, and it does have connections with larger oceans. It is more like salt water as opposed to fresh water. And so I did see data suggesting that it could be there in significant quantities, but not a lot of hard granular details on exact amounts of exposure or amounts per milligram of salt.
Yeah, I know. It was just hard to find anything. I told her to err on the side of caution, cut it out, and then just retest her TSH. And about 4 to 6 weeks later, her TSH was back down to 2. So we're just going to continue to monitor that and see how she does. But yeah, it was just an interesting thing of how much do you actually absorb through the skin? Is it actually in these products? So I know, are we going to possibly talk about some absorption through skin products?
Yeah, for sure. I'll give you guys just a quick rundown of what I've thought about this, what I've seen so far, and happy to any other questions or observations. So I was thinking about that, where can there be other iodine sources coming in? I've seen some good tables showing that urinary iodine excretion of U.S. residents of certain subpopulations, a lot of people are pouring out a lot. And there are many dietary sources that are outliers, that are unexpected, but I thought there could be other factors as well. So then I thought through about just topical products. And I don't know if one of you all meant where it came from. Okay. You got a case? Okay, I'll talk about this, just some numbers. So I thought that through, and I realized that, yes, that in many of the things we do put on our skin, we do have ingredients that are very iodine-dense ingredients. Polyvinyl pyrrolidine is the most common one. There's actually a lot of others, and we'll get some things in the show notes about this. But this is something that, by weight, it's about 12% iodine. And products aren't just PVP. They've got a lot of ingredients, but that's one of them. And so then I wanted to figure out, okay, how could this be wrong? How are the ways in this which could not be relevant? So I figured, how much PVP is really in a skincare product? What percentage does that make up? And I did some digging, and I saw a range of often about 5% to as high as 40% by weight. So it's a lot. And it's used as a texturizer, as a texture stabilizer, and as a preservative in many creams. So it's a popular base. And I actually saw a lot of home recipes of DIY skin creams to where you just buy that in bulk because you go through tons of it. So yeah, you could get up to 40%. And then I thought through too, you put something on your skin, well, it doesn't all absorb. So you've got healthy, intact skin, and perhaps there's data saying that if your skin is injured or burned, then yeah, you could absorb more, but healthy, intact skin, how much would come through? And the best numbers I saw there were about 4.5%. So you put an iodine-containing compound in healthy skin, probably about 4.5% of it will get absorbed. And this has been looked at, and actually the FDA, not that long ago, they banned the topical skin antiseptics from containing iodine. They saw this as a safety hazard. Healthcare workers, there were some cases in which healthcare workers who were using skin-based iodine sanitizers, washing your hands often throughout the day, most of them had urinary iodine concentrations that were completely unsafe, high enough to trigger thyroid disease. So yeah, the FDA banned those things across the board. And there's been animal studies showing that dose per dose, topical is just as strong as oral at blocking thyroid function. So you could take a mouse and you could put 2 grams of iodine on their skin, give another mouse 2 grams of iodine orally. Well, no, 2 milligrams. 2 grams would kill them, sorry. 2 milligrams. And the mouse with the topical would have more of a suppression of thyroid function than the mouse with the oral. So big thing. And then I thought through, then how long does that really take? I kept trying to think about how this could be wrong. So what if it's just on your skin for a little while? And basically what we've seen is that within about 2 minutes, the bulk of that 4.5% gets absorbed. And then I thought about, how much skin surface area are we talking about? What if it's on a little spot? Well, it's about 2 centimeters if you got just 2 cubic centimeters. So somewhere about the size of a dime is all you would need, and about 2 minutes in duration. So then I ran the math, and I thought about this in terms of types of cosmetics. So one example is mascara, and that can be on the higher side for iodine compounds. But how much volume of mascara do you actually use, and how much skin contact do you have from mascara? There's not that much volume. It's on your lashes. Sure, there's probably some contact on the roots. I would have to think that's negligible. But then I thought about things like night creams you put on your face. It's a fair volume of cream. You leave it on. Or hair conditioners. It's a fair volume. It's there for a while. And it's also like, your skin is warm. It's moist at that point in time. So here's one example in terms of hair conditioner. So you're taking average is about 10 mils of volume. I found that stat too. And that's not a huge volume if you think about that in terms of like a recipe or cooking or macro ingredients, but that's a pretty big volume when we realize that the iodine world is the world of micrograms. So that 10 mils, I'm going to convert that now to make all the math be smooth. That 10 mils, that's about 10 million micrograms of base right there. So that's not all iodine compounds. And some conditioners are higher, much higher than this, but a lower number that I saw was about 3% containing PVP. So if 3% is PVP, that means that 10 mils of conditioner is going to be about 300,000 micrograms of iodine, of PVP total. And now if PVP is about 12% iodine, well, now we're down to about 36,000 micrograms of iodine. So still a lot. And if we're not absorbing all of that, but if we look at the absorption parameters, we're still getting about 1,500, 2,000 micrograms of iodine. I saw another number suggesting that with longer exposure, it could be 10.9% absorption. And that number gave about 3,924 micrograms of net iodine in the bloodstream from using your conditioner. I won't do all the math steps, but for a night cream, for a skin cream for night use, easily can have 5% PVP. You run the numbers through of all that, and you're talking about 9,800 micrograms of iodine you could absorb by putting skin cream on at night. So this can be a big deal. Now, I just heard Dr. Kashaba say she's got a case that's relevant for this. So here's Dr. Linda Kashaba with us.
Awesome. So this is actually a mutual patient. She used to see you when you were in clinic. And I did see her, shortly after you left. And then I kind of continued to follow her care. So she had stable thyroid condition. And then out of nowhere, like 2 years ago, her thyroid became suppressed. So her TSH became really low and she started to have hyperthyroidism. So we got her on hyperthyroid medication
And luckily, now I've been able to kind of wean her off, so she's not on any medication. But as we continue to investigate, the sources of iodine that might be coming in, I went through her diet. She's French, so I thought maybe they eat a lot of fish, or they, traveling and seafood and things like that. So she's really good about her diet. Also cheese. They're big on cheese. So, but she said that she's really doing a good effort in cutting it down. So then she's like, let me ask you something. She's like, I buy this very expensive skin cream, very expensive. And I know the cream. She purchased it at Nordstrom. It's probably $400 for one, yeah. It's very expensive. Anti-aging stuff. It is pricey. So I look it up online, and the first ingredient is seaweed. So I said, bingo, so that's exactly, probably a huge source of where her iodine exposure is coming from. And we know that the World Health Organization recommends like 150 micrograms as of 2017 in an adult. And if she's getting that much seaweed, and I just kind of did a search, but for every gram of seaweed, there's approximately 3,000 micrograms of iodine in it. So I don't know how much she's applying. What if she's applying it to her neck and her face? So maybe 1 to 2 grams. But I told her she has to go return the cream, and I know her husband's going to be super happy about that. So, so we're just going to be watching her thyroid. But I think that this was a huge eye opener, and because we, as doctors, we're not we don't really inquire about cosmetics or skincare products. I mean, we do for toxicity and other components, but never thought about using inquiring to see, if iodine is a culprit in thyroid disease.
We'll be right back after word from Integrative Health.
We hope you are enjoying this episode of Medical Myths, Legends, and Fairy Tales. This is Dr. Linda Koshaba at Integrative Healthcare. So often we hear from our patients that their primary care physician has told them that their thyroid and hormone levels are fine, and they shouldn't worry. But the patients still have symptoms of severe fatigue, thinning hair, and weight issues. Unfortunately, this is too common with thyroid care. The good news is that we can help. There is hope. The doctors at Integrative Health, including myself, specialize in naturally treating thyroid, hormone, and adrenal issues. We would love to get you started on the path of ideal health. From the comfort of your own home, you can actually get treatment with one of our doctors at Integrative Health via a telemedicine appointment. Go to integrativehealthcare.com and become a new patient today. If you use the code PODCAST20, you get 20% off your new patient visit. Again, that website is integrativehealthcare.com and use code PODCAST20. Get back on the road to thriving.
And now, back for more medical myths, legends, and fairy tales. And here's a couple of ingredients to look out for. So I mentioned the PVP. Some other names of it and other compounds altogether would include ammonium iodide, potassium iodide, sodium iodide, iodoform, hydroxypropofol, oh boy, bistrimonium dioxide, TEA, see that one a lot, ethiodized oil, iodopropanol butyl carbamate, and then various seaweed extracts that might say things like fucus, laminaria, or kelp. But yeah, those are some of the big things to look for on labels with products.
Dr. Ruiz here. So we've seen the studies about using topical iodine for final aspirations, and that's suppressing the thyroid long term. We've seen the studies about the how iodine is not really standardized in supplements, and now we're seeing another culprit with this with care products. And then what gets really scary is when you start seeing things online about how to cure your sinus infections forever, and people are doing neti pots with iodine. Or in school we learned about using nebulized iodine to help with your sinus infections. So we need to be very careful. It is a very potent antimicrobial, but it has other side effects that we have to be very cautious about.
And a big part of the history of iodine in medicine was that, yeah, it's one of the ultimate generators of free radicals. So to be really precise, we're almost always exposed to iodide, but once we ingest that, there's some conversion processes that convert it to iodine, which is a huge source of free radicals. And that's why it's antimicrobial. That's why it kills infections very well. And yeah, there was a lot of past applications in which medicine would use it for topical infections or orally as an expectorant in higher doses. But by and large, those things have gone by the wayside because they've recognized just how much thyroid toxicity goes along with that and tried to find other ways to achieve those same antimicrobial effects without the thyroid side effects. Dr. Rosalind Rainin here.
Hi there. I just want to add to Dr. Kashaba because we see a lot of women in clinic and, they're not really fully aware of the anti-aging that they're using. And I guess we have to kind of be an educator to let them know that kelp, seaweed, algae, they do contain iodine. And so, a lot of these anti-aging, they're also used for brightening skin, for hyperpigmentation. And you see that quite a bit out there for people. And since Dr. Kashaba had shared that case with us, I'm like, well, I better check my body washes. They are now in lotion because, they follow now the La Mer, who has that seaweed all-star ingredient. So, they're trying to kind of mimic that. But I think, for a lot of women, we have to be cautious, especially if the number one ingredients is either it's algae or seaweed, kelp. They do contain iodine. So, I think that was a really good case for us to even myself to be aware, putting something on your skin on a daily basis, if not morning and night. Right, guys?
So, yeah, and that's the thing is that because of micrograms, even if it's a secondary ingredient, even though it's not all that ingredient, even though the ingredient's not all iodine, even though we don't absorb all of it, it still can end up netting significant amounts of micrograms. I think Dr. Kashab has something more for us here.
Another interesting thing that it's not actually in skincare, but I found it in a patient who came in and she's on blood pressure medication. So it's not even in thyroid medication, it's in amiodarone. So this is used to treat hypertension. And I did a urine test with her, and I was so shocked of the score. It was over 16,000 in terms of how much iodine was being output, through the urine. So even you just have to inquire, like, where is this coming from? But if you see those medications, or if they're on thyroid medication, even thyroid medication, just to let people know that it does contain iodine. So for every 1 grain that we use natural desiccated thyroid, there's about 130 micrograms in there. So just to be, cautious, because in those people on thyroid medication and they take external iodine or get it topically, those are going to be way more at risk. They just have a shorter and narrower window to get external exposure.
Yeah, for sure. Medications can have a ton. Amiodarone is a classic example of that. Just an insight for docs. I was reading up on a lot about the comparisons of serum versus urinary iodine and how those things equate. I was hoping to find a linear relationship by which if someone had a serum iodine level done, they could plug that in and compare that against creatinine and get a sense of their iodine-creatinine ratios. The project was unsuccessful, and the problem is that there's not a linear relationship. So it turns out serum iodine is pretty highly buffered by the body, and you work hard to keep that within parameters, even across a large gradient of intake. So if you're consuming very little, you still will have enough in your serum until just the bottom drops out. And if you're getting too much, your body will still prevent the serum from being excessive until you can't dump it quickly enough anymore. So it's not a very linear relationship. The one real legitimate use of serum iodine levels is in a patient like that, if they're on a medication or recently been given a contrast agent. Serum iodine is a good marker for iodine toxicity. So when someone is past that threshold in which they can no longer regulate it, then the serum levels spike. So there are some people, when they're exposed to massive amounts from sources like that, their urine might go up really high, but they're not always affected. But whenever the serum levels go really high, they're pretty much always affected because they can't really dump it any faster. So even a high urinary level is still a large risk factor, but behind the scenes, that's the body trying to get rid of it to maintain equilibrium. But once the blood levels have gone up too, you can't be able to ship out any faster. You can't dump it out quickly as you would like, and now it's permeating the tissues and hitting a saturation point. So that's one case in which serum levels have a legitimate use, but there's really not a valid use for them at all in terms of evaluating day-to-day status on iodine. So yeah, quick case study. Couple of good case studies and some interesting facts, but something to be aware of. So more sources than we thought, not just from the diet. For sure, medications can have it. We'll go deeper in that sometime too. But topical compounds, take a good look at what's in your bathroom, what's going. Coconut oil. So my favorite line about coconut oil is move it into the bathroom, out of the kitchen, into the bathroom. Lots of great data about using it in the bathroom. Lots of nice, safe applications and no real iodine issues. So yeah, good point. All right, thanks for tuning in. We'll see you guys soon on another episode. In the meantime, take great care. Bye-bye.
Bye.
Hey, Dr. Christensen here. Thanks so much for joining me for another episode. Is there a topic you'd like me to cover? I'd love to hear from you. Just go to Dr. Alan Christensen on Facebook or Instagram, write your question, and use the hashtag #MedicalMyths. Did you find this show helpful? If so, please take a minute and leave us a rating on iTunes so that others can know. Thanks much, and I'll be back with you real soon. Bye-bye.